welcome to yet another coffee conversation of WIOF, World is One Family. I'm Shiv, founder of WIOF, and today we have with us a leading pulmonologist from Mumbai, and he also happens to be my school friend, Dr. Subbu. And welcome, Dr. Subbu. It's really a pleasure to have you here with us on WIOF, and our conversation is going to provide a lot of insight to people and on COVID issues and as well as air pollution. So really happy to have you here.
Thank you. Thank you. It's my honor, Shiv. And I hope I serve your purpose.
Yeah, okay, absolutely. So yeah. So let me, begin with my first question. How difficult has been the last 18 months, for the medical fraternity, including the doctor, nurses, frontline staff, because we have been through very difficult times. We handled the first wave, but the second wave was deadlier, which wasn't expected. And now we might be heading into a third wave also, with all the festive season remaining. What do you think?
True. So you're right. These have been really unprecedented times. We have seen a lot of our colleagues, doctors, nurses, dying in this pandemic. It's very sad to say that. And I mean, there is a lot of fear amongst all doctors also still. And many of my friends have been getting COVID the second time now. Many of them got infected in August, September, and now a couple of them have again got infected now. And we've seen our old patients, old age people dying, many of doctors' relatives, their parents dying. I mean, it's been really bad for us as healthcare workers. But some positives in the sense we have had good vaccination pickup at least in August, and we hope it really goes really fast and we are able to vaccinate a lot of our population at a very short time. I wish I had a crystal ball where I could see and tell when is the third wave going to come, but nobody can predict. Even before the second wave, people in November said there'll be no more waves because we have had the worst. And then we know how devastating mid of March to April to May was for us. But at the same time, we cannot remain in lockdown for a really long time. It's maddening to remain inside four walls. So we have to go out for work. Children have to go to school. We have to go to temples, we have to celebrate festivals. But what is there in our hands is good masking and social distancing, at least keep a gap of 6 feet, which is where we are erring. We don't practice those basic principles religiously. We need to have a good mask on when we are going out, when we are going in public places, closed spaces, and we need to have a good social distancing. Crowding has been our main factor which is leading to a lot of COVID cases. That is what we have all been doing.
Right, doctor. I mean, very sound advice. Now that you have mentioned masking, I want to ask you one thing. We might eradicate COVID probably in a couple of years, but I see the use of masks even beyond COVID as such. If you look at the case of Delhi and all, which has been seeing very high air pollution in the last decade, you would find that even people were wearing masks even before COVID. And, people in the other parts of the country weren't used to wearing masks. But I feel that, even after we conquer COVID, we probably shouldn't let go of wearing the mask because it might be a great tool against fighting air pollution. What are your thoughts on that?
Correct. So wearing a mask is quite protective against a lot of viral illnesses and bacterial illnesses as well, like we have seen in COVID, influenza. For the last so many years we have been seeing. And now with regards to air pollution needs a lot more concerted efforts, from the citizens, from the government, from local government bodies and everything. You need to have a definite framework, policy decisions, and then maybe we would be able to tackle that menace. It is not just masking, because mask is going to protect you from particulate matter, the PM10s, PM2.5s, But then what we need to have is we need to have religious indices which are displayed prominently in road junctions. You need to have those indices coming up in the newspapers on daily basis. I mean, we have a couple of indices in the roads in the lanes where we travel in my local area, but most of them are shut down. I don't know when they're going to start back. So it will give people an advance indicator as to whether you need to really step out with a mask or something. So a lot needs to be done. There should be a lot of policy framework and guidelines for air pollution. But whatever said and done, masking is going to give you some kind of protection from air pollution. So masking is the way in the future as well, I feel. COVID has opened up new realms of possibilities for us.
Right. Yeah. Again, Doctor, yeah, you are right on that. Masking along with a little bit of policy towards air pollution will certainly go a long way. Yeah. Thank you for that advice, and hope our government also looks into that. One more thing which I wanted to ask you was, the symptoms which people faced during COVID. Most of it, I would assume that most of it would be, difficulty in breathing, and followed by fatigue probably. And do you think how to tackle this particular thing? When people have this, because some of the people, like even me, who have recovered from COVID, we continue to face breathing difficulties even after after recovering for many months, and we still continue to have this along with fatigue. How do we actually tackle that?
Correct. So COVID per se has a lot of adverse effects. We only those very few really serious side effects came up in the papers, like all those black fungus, white fungus, and all those. But then we have been seeing a lot of fatigue, mental illness, cough, breathlessness. This all comes under the purview of long COVID syndrome, or what is called as PASC, post-acute sequelae of COVID-19. So I mean, a lot of us have been seeing these symptoms, maybe right up to 9 months after recovery from the illness. But by and large, most of these symptoms are self-limiting. What we felt that there would be a tsunami of lung fibrosis and tsunami of lung patients coming after COVID never really happened. Most of them was self-limiting, fortunately. So basic measures like breathing exercises and all would really help you in overcoming these difficulties, and having a good diet, taking a walk. Once you're completely recovered, your oxygen saturations are normal. Once you're up and about to go outside, then you should resume your normal work. That is going to put you back on track.
Okay. Yeah. But do you think people, in cities will face these effects more than the people in villages, in terms, because the air pollution also makes it worse for them? You might have seen over the years people coming to you.
Correct. So what over the years we have been seeing is there's a lot of allergies in cities. There's a lot of COPDs, chronic obstructive pulmonary disease in cities. There's a lot of obstructive airways, asthma in cities. Less so in villages, because there is a lot of open land, open space, and less crowding. So this is what we have been seeing, and COVID has put it back on focus. Crowding is what is causing all these issues. Plus, there is high pressure density of people in a very small area of population. A very small area of cities is what is causing a lot of illnesses. Now, coupled with that, we have a lot of vehicles, industries, all right next to our houses and workplaces. That is all adding up to air pollution. And we know air pollution causes a lot of reduction in immune responses, and which is what is required for COVID affection. The COVID virus wants that our immunity has to go down, which is what is happening with all this air pollution, industrial pollution. And so basically, we know COVID spreads by droplets, but we also know now in recent evidence that COVID also spreads like an aerosol. It's an airborne spread now. There were times when we used to say, okay, COVID spreads only by droplets. It is not going to spread in the air, but we know now it is in the air. So air pollution is going to couple all these things. You know, this particulate matter PM10 to PM 2.5 is all going to make the COVID viable even in the air, and then slowly you will have all these infections.
Okay. Okay. Yeah. Yeah. I understand that, doctor. I have one additional question to you. I mean, all these people, I mean, whether they are suffering from COVID or not suffering from COVID, obviously we want to be, in the best of health and not have these breathing problems and all that. Wanted to ask you whether, you can answer me in medical terms, I mean, with medical science, does pranayama, I mean, or breathing exercises help you? Do some yoga asanas help you open up the airways and make it better? Or, things like proning position, which was taught to us while we were recovering in the hospital from COVID, or, even the spirometer exercises, do they help you? I mean, which would you recommend? I mean, among these four things for normal people who want to have better lung function, what would you recommend?
Right. So what we have all been knowing for last so many years is breathing exercises, what we call as PLB, pursed lip breathing, where you blow, expire at a long, and what we do in pranayamas, and kapalbhatis, what is commonly taught to us in yogas, and diaphragmatic breathing, where you keep a hand on your tummy and then you breathe and put some pressure on your abdomen, stomach. So this is all going to increase your lung capacity, is going to improve your respiratory muscles. It's going to relax you, reduce your heart rate, reduce your breathing effort, reduce your breath rate, in turn improve lung function subsequently. And so whether objectively the lung function improves is a big question, but I believe I'm a very big believer in pulmonary rehabilitation. We send many of our patients for pulmonary rehabilitation. This graded exercise program, which is done over 12 weeks for patients suffering from severe lung diseases. And, they have dramatic improvement. That's what most of the patients come out of oxygen. And that's what we have been seeing for the last almost 15 years. So for normal people, you need to go out, take a deep breath, do basic breathing exercises, your good lung exercises, good yogas, not more, at least 20 minutes a day, you need to give time for yourself. That is what is going to work for you in the longer run. And for your well-being, you need to have good exercise program, which you should be religiously practiced.
Okay, great, great, doctor. Yeah, that's very, very valuable, and will be useful for our people. I also want to ask about, I mean, we talked about exercises and all that. I want to look at the question of diet. I mean, I want to ask how much it is related. We talk about people having unhealthy diet nowadays, right? Because of the fast world that we live in, all this junk food which we eat and all that, which obviously we know that places a strain on the heart, with cholesterol, bad cholesterol and all coming in. How much does that contribute to the functioning of the lung? I mean, is there a link? If so, how much is that link? Would you advise better diet for people also to have better lung function?
So what we have seen and what we advise to our patients is, for the lungs, you need to maintain a good low carbohydrate diet. Very high carbs are not good for patients who are suffering from breathlessness, obstructive airways disease, asthma and all. So eat healthy and stay healthy is what we always advise our patients. We are made up of what we eat. So you need to eat wisely. And there are many, many illnesses, right from cardiac to respiratory to GI. All these illnesses have a definite association with our diet, and we need to really maintain our diet. For lungs per se, low carbohydrate diet is what we recommend to all our patients.
Okay, great. That's very valuable advice, doctor. I even I have been following low carbohydrate, but this has opened a new light for me. I probably need to concentrate on that aspect a little more. Yeah, and I think we come to our final question. I just want you as a doctor, not only as a doctor, but as a fellow citizen who knows and cares for people around, what advice would you give to them so that they maintain a better health overall? And let's say people want to take up some rehabilitation program, in terms of even lung improvement, lung function improvement, or all that. Can they reach you, or can they reach your network of people who can help them? Is there a way to reach you? I know that you have the lung center working, but can we reach you on Facebook or something? Can you throw some light on that so that it will be useful for our people who are watching this?
So basically, you can always reach us. We are on Instagram with the name of Lung Center. We are on Twitter. We are on Facebook also with the same name, Lung Center, LUNGCENTRE. Now we put a lot of updates on our websites and Instagrams, which run updates on daily basis with regards to respiratory and allergies. So let us first understand that the adverse effects of air pollution and industrial pollution are all real. I mean, climate change is there, it's real. That's what we have been seeing, and over the years, it's just going to worsen. So what I would advise you all is to take care of yourself first. You need to take out half an hour time for yourself. You need to go out. If you're waking up at 6:30, wake up at 6:10. Go out, go for a brisk walk on daily basis. Then do some basic breathing exercises, do some basic warm-up exercises. We are not asking you to go to the gym and sweat it out. I mean, it's your personal choice. Then you need to talk to your friends, your colleagues, and then you need to free up open spaces, which is what there is a dire need for them now. We need good gardens, good walking spaces. What I always tell my patients is, you plant a tree just once a year. It is going to make a big difference for your next generation. We are breathing because our ancestors have planted these trees, and then we have been cutting them, of course, but then they have planted to a large extent. So that is where we are all standing. So that is what I would advise. And keep safe and keep healthy, and wear a good mask. Masking is here for a very long time, I feel now. COVID has opened our eyes.
Yeah. Thank you so much for the wonderful advice, doctor. I mean, it's really nice to have you and talk about all these important aspects, which will prove very useful for all the visitors who come to our website. And I hope that together we all can make a better society and a better planet to live in. And that was the intention of having this conversation. And stay in touch, doctor. I know you have a very busy life, but to stay in touch, and we will keep connecting over these issues from time to time. Okay.
Sure. Thank you so much, Shiv. Thank you for giving me the time and asking me so difficult questions. And
yeah, we live in difficult times, so some questions have to be difficult, right?
True.
But yeah, it's been a pleasure having you, Dr. Subbu, and have a nice day ahead. Yeah.
Thank you so much.
Thank you.